life. And I remember another Instagram post you put up where, and it was beautiful because you said after 8 years of two people trying to be a parent, you were part of the process that gave them a baby boy and a baby girl, right?
Yeah.
And
Oh
I
God, that's
and
so big.
I was actually looking up the definition of fetal surgery, and it says it's a procedure performed in an unborn baby fetus in the uterus to help improve the long-term outcome of children with birth defects. So, in a lot of ways, at that point, when you intervene, you can change the life of that particular family and that baby. So, you know, like help me understand a little bit about the professional life of somebody that's a fetal surgeon. And I know, you have you can't share stories because you can't give names and you need to protect the identity of your
Oh yeah.
patients, but there is, if there's any like experience, like you share some photos of those without naming names, could you like share some stories of very touching moments in terms of like medicine and your ability to practice fetal, like the story of the parents with after 8 years? I mean, I can't imagine the emotions they must have felt when they saw their
Oh God, they
babies.
they send me photos of the kids growing up, and now they're like 3 years old this
Yeah,
year. They keep sending me photo like the kids still amazing, they're fine,
that's
healthy,
amazing.
that's what.
That's amazing.
So yeah, that's so the thing is I'm a long way away from being a field surgeon. So I can tell you about field surgery, which is very little, because there's actually very little things happening all around the world.
Hmm.
First of all, there might be like there's a two-digit number of actual fetal surgeons
Oh,
trained to do field surgery.
okay.
So basically, it's taken up by people who have done pediatric surgery, and it's their forte now, which is why I would have to do all this. This is for a long path for me right now. So in India, we have a couple of surgeons performing pediatric surgeons performing like one or two procedures
Hmm.
of like fetal, because the fetal surgery is still at its like conception. They're like maybe like 6 7 procedures that are regularly done or that can be done, that's advised
Hmm.
and that is declared safe by research and trials. A lot of procedures are under trial and a lot of them have bad outcomes. See, the basic principle is this: if a kid has to undergo surgery when it's a fetus, the kid is in such a bad state already.
Hmm.
So the chances of survival for that kid is very little.
Sure.
So that is naturally very little for that kid. So any procedure done on that child to increase its chances of life, you need to have done it on enough people to know if it's actually helping people. But it's very difficult. There are a lot of it's a very fine line. There are a lot of ethical issues, and there are a lot of schools of thoughts regarding field surgery. The programs being shut down in a lot of countries. A lot of countries are against field surgery. It's also a lot of. I remember talking to one professor once, because, like, I talked to a lot of people abroad, because see, to learn this itself is so hard. There are very few people who are actually doing it. So imagine learning and teaching. It's
Hmm.
another level. So so I remember asking, so any kind of help I get or any kind of information I get, I try to collect on it. So I remember asking one pediatric surgeon, he's like, that's something that's a branch going to die. You want to go into a branch that's gonna like sink, is what someone's asked me. And then I know personally a lot of pediatric surgeons who tell me that they don't believe in intervening
Hmm.
in nature's course at that point. So see, these are all different thoughts, and I respect everybody's opinions. But that's what. See, I don't know what are the qualities of a good doctor. I mean, I should being a doctor. I might know. I don't know if I agree to what everybody thinks. Um, I think what makes me help people is the fact that I personally am more fascinated and enjoy doing surgery, and I'm glad it helps people. But it's I'm not doing this because I'm not doing this because, oh, I'm glad I did not want to be a doctor because I wanted to help people. I'm glad what I'm doing helps people. I wanted to be a surgeon, I wanted to be a doctor just because I enjoy doing it. Like, as
Hmm.
simple and basic as that.